Hi everyone, this is Upasna, your friendly neighborhood scientist, and today we shall be talking about dealing with the new normal. It's slightly longer than my earlier videos, but it answers some of your pressing questions like should you get an oximeter? Does the antibody test really tell you whether you're safe or not? And when should you get tested? So for this video, you require some knowledge about the immune system. So if you haven't watched my earlier videos, please click on the link in the description and watch them first. And if you have, then let's get started. There are a variety of testing methods now available in the market, and it is difficult to understand which is best for you. So I'll be taking you through each of them one by one. First, we have RT-PCR. RT-PCR stands for reverse transcriptase polymerase chain reaction. That sounds like jargon, so let's break it down. A virus is made of genetic information encapsulated in a protein envelope. In case of SARS-CoV-2, this genetic information consists of RNA. The RT-PCR method relies on detection of this genetic information in samples from the respiratory tract, like nasal swabs. The RNA from the virus cannot be detected easily when coated with protein. When isolated from the protein, it is not stable for very long. Also, it cannot be detected at such low levels. In order to get a stable, dependable signal, first the RNA is converted into DNA using an enzyme called reverse transcriptase or RT. Next, the DNA signal is amplified by producing multiple copies of it with the help of polymerase chain reaction or PCR. For this step, scientists use small fragments of DNA called primers that can aid the copying process only if the DNA matches that of SARS-CoV-2. In short, it is highly specific and no signal will be received if virus was not present in the sample. The chances of false positive are relatively low. This test is also highly sensitive. If the sample has been collected properly, even a single virus can be detected with this method. The major disadvantages of this method are: it is extremely time consuming and can take at least 6 to 8 hours to get a diagnosis. The components of the reaction are costly and some need to be imported. Thus, it is expensive and not easily available. However, it remains the most bankable of all available diagnostic tests. Next, we have RAT or rapid antigen testing. This detects the presence of key viral proteins or antigens in the sample from the respiratory tract. The testing strip has a lab-generated antibody which binds to the antigen and gives a visual signal. The accuracy of this test depends on 1. The time post-infection at which point it is conducted, 2. Concentration of the virus in the sample, 3. Quality of the sample, 4. The way the sample was processed, and 5. Quality of kit components. The advantages of RAT are that it is cheaper, can give a signal within 30 minutes, and gives the best results during early stages of infection. However, it has a much lower sensitivity than RT-PCR and could miss many positive cases. Moreover, these kits are still under development and might give false positives in case the antibody in the kit reacts with other coronavirus agents like the common cold. Thus, it is best used only to speed up testing for prime suspects and quarantining them immediately. However, it is quite promising, and more research in this direction could lead to widespread testing. The most hyped up testing method would be the antibody detection test. This is an indirect test that checks for antibodies in the blood serum. As I have explained earlier, B cells of the immune system produce antibodies in response to infection. Various types of antibodies are produced, and a baseline level of them lurk in our body fluids, waiting to attack. The two types you need to know of are IgG and IgM. IgM antibodies are produced as a primary response to the new infection. They are seen within a week post-infection and quickly clear out from the body once the infection is cleared. IgG antibodies are the secondary response. IgG levels rise as IgM levels decline. IgG antibodies can hang around from several days to many years and are responsible for lasting immunity. They are ready to respond in case of a second infection. Thus, antibody tests can tell us whether someone got infected and recovered. However, as antibody levels are detectable much later, these tests should not be used as diagnostic tests. Moreover, we do not have enough knowledge to understand what these tests mean. Qualitative tests give yes or no, that is positive or negative results, but no numbers are involved. Therefore, they do not provide any information except whether or not you were infected. It is possible that you had a mild case that did not generate a strong enough immune response to protect you from a secondary infection. Quantitative tests provide values called antibody titers that indicate antibody concentrations. How effective your antibody titers are depend on the reference titer values. In case of diseases like polio, where decades of research have been conducted, we have established reference titer values that indicate your level of immunity. In case of COVID-19, a novel virus, these values have not yet been established. Thus, antibody tests are only useful for scientists trying to understand the disease and develop treatments or vaccines. They do not help you as an individual in any manner. As far as claims regarding immunity go, there are several cases of suspected reinfection, including a nurse from Mahim in Mumbai and a photographer in Nashville. Now, they tested positive just a few months post the first bout of infection. Now, investigations are still on to determine whether this is due to reactivation of a dormant virus or a second infection. With an overwhelmed healthcare system, flu season around, expensive testing methods, and so much confusion, we come to the question, when exactly should you get tested? In case you have underlying conditions such as kidney disease, heart disease, diabetes, or other comorbidities, please consult your family doctor. In case you are a healthy individual in the age group of 18 to 50 years, Dr. Sushila Suresh, whose video link is in the description, has some general advice. When you develop flu-like symptoms, firstly, isolate yourself at home. Monitor your temperature thrice a day and treat fever only with paracetamol and rest for 3 to 5 days. Normal flu clears within this time frame. Between day 5 and 8, check for breathlessness and dehydration. Go to authorized testing centers if symptoms persist beyond day 5. If diagnosed as COVID-19 positive and there are only mild symptoms, one can recover in home isolation. If problems like breathlessness arise, only then would you need to get hospitalized. Please note that these are just general guidelines and cannot be taken as clinical advice. So if you have any questions, please contact your family doctor first. And now we come to the final question, should you really buy an oximeter? The short answer to the question is yes, maybe. It is highly possible that normal oxygen levels in the blood drop suddenly and that this could happen even due to non-COVID related reasons. But oximeters are useful for people who already have respiratory disorders like COPD and to monitor blood oxygen levels in COVID-19 patients recovering at home. Note that oximeters use light to measure oxygen saturation levels in the blood. They could give inaccurately low readings if the user wears nail polish or has acrylic nails or has long nails that prevent the finger from being placed correctly, or lighting in the surrounding area that interferes with the readings, or the user has cold hands, or generally poor circulation, or high lipid levels. Therefore, it is only advisable to buy an oximeter if you know how to use it correctly. That's all for today, folks. I hope you had fun while also learning from this video. And if you have any questions, please leave them in the comments below and I'll do my best to answer them. Please beware of companies who are trying to profit off your fears by promoting all these fancy kits, and go for antibody testing if you suspect that you had been infected before and you wish to contribute to the fight against corona by donating your plasma or supporting scientific studies, but know that they are not going to benefit you personally in any manner whatsoever. Stay safe, take care, and goodbye.